All right, it's one of the raging COVID-19 debates. Should we all be forced to carry proof of vaccination or face being blocked from events, from travel? Unesco has called for ethics research around a COVID-19 vaccination passport, saying these should be done in a way that makes everybody healthier and really doesn't discriminate and prevent movement unnecessarily. To discuss, we're joined by the Program Head of Bio and Research Ethics and Medical Law at the University of KwaZulu-Natal. That's Professor Sylvester Chima. Thank you for being with us, Professor. Just firstly, do you have any introductory remarks on the ethics around the very idea of a vaccine passport? Professor, you need to unmute yourself.
Yes. At this particular point, sorry.
Carry on. Thanks, Professor.
That we are in a, okay. At this particular point, one can say we are in a state of moral and ethical dilemma. Because initially, what was happening is that, first of all, we were confronted by this new infection, which we didn't know the cause. Then we found the cause, and then the problem was, how do we manage it? Now, eventually, we found out we're able to develop a vaccine in rapid time. Now, the is confronting the world, or the world generally, is the issue of vaccine hesitancy, especially in, it's not only, I would not say only in Africa, but also in many developed countries. People are hesitant about, taking the vaccine. So now, how do we convince people to actually take something that is useful in order to assist them to be safe from a deadly virus? And this is the dilemma that we're confronted, and we have to do it in an ethical way, in such a way that we don't infringe on more of people's rights which have already been infringed. Now, looking at it ethically, so in ethics, what we're trying to do is to find, a justifiable way of doing the right thing. Let me put it that way. So one of the things that we can do is, one of the things that has been proposed, as we are discussing today, is whether we need to introduce vaccine passports. Now, again, the problem arises from when we introduce these vaccine passports, how do we make sure that individuals are not, their rights are not violated? So this creates a moral dilemma in balancing the rights and responsibilities. I personally see it as there are other ways that we can approach this issue apart from having, outright vaccine passports. We have to try other means. Some of the ways which we, suggested initially were trying to give people informed information so that they can make an informed choice. You give them as much information as possible. Most of the time, when you give people information, they will make the right decision. However, we have found that there's a lot of wrong or misinformation or rumors and things like that that are discouraging people. So we have to move people beyond this. And in my own opinion, one of the things there are ways in which we can do this. We can look at the population that is affected. Right now, according to this, the population that is affected is mostly, at least people who are succumbing to this disease, are people who have comorbidities, especially the old age people. Now, if we look at it from the point of view of South Africa, we will see that the old age people are also these people who are receiving grants. Now, according to the statistics that are available to me, that's published in the public domain, there are about 11.4 million people who have actually on grants. Meanwhile, the number of people who have received this vaccine are only about 7 million people. So there is a gap there of almost 5 million of people who require assistance from the government but have refused to actually do the right thing. In other words, take responsibility. So from my point of view, I would think that this population, for example, one of the things we could do is to request that those people, before they collect their grants, that they should, provide proof of, having gotten immunized.
But Professor, isn't this even more extreme than carrying around a passport to travel or get into restaurants? You won't get your social grant if you don't get vaccinated. That's really taking away all choice from somebody who needs the money.
No, 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 it's not. Already you have a lot of restrictions. For example, if you don't wear, even if you get your money, if you don't wear a mask, you can't go out into the shopping, into the shopping mall and buy your food product. So that's a form of restriction. If you don't wear your mask, you can't get on the taxi, minibus, and go and do your shopping or do a lot of other things. So if we say, for example, it's just a way of trying to get people, I don't think it's too restrictive. This is just a way of saying, when we look at it constitutionally, people have rights, a right, for example, to shelter, a right to food, a right to medication. They also have responsibilities. So one of the things that we could ask for those people who are asking for this right of assistance is to do your own part, which is, act as responsible citizen, in other words, by doing your duty, which one of those duties is to, for example, get immunized so that we can assist you. Remember. Yeah, go ahead.
Professor, your view is interesting. We're running out of time. The debates, I mean, you've raised the whole issue of whether you can withhold social grants. The debates have been around travel, and I think there's more acceptance. If you travel in certain parts of Africa, everybody does it. You have to have a yellow fever or other vaccinations because you can't go there and get very sick and be a strain on their health services or bring back a disease to South Africa. That is just required, and we accept it. But what about going to restaurants, for example? Somebody who's not vaccinated can say, well, why should anybody be bothered about me? If they are vaccinated, then they've got protection. Why should I be barred from going to a club or a restaurant or an outdoor event?
Okay, but how many of these people that we want to get immunized actually go to restaurants? That is the question. That's a number you have to look at. Most of these people, they buy their food in the local sources or the spazas, and they go home and they say, so it's not that what they do is they go to church, which you say we should restrict them from going to church if they don't have vaccine passports. They go to their funerals. You say we should restrict them from going to funerals. Already they are restricted, to go and bury their their loved ones if they don't have vaccine passports. So majority of, we have to look at it from in part where it will have the most this thing. Now, one way it will affect, some of the people, maybe football matches, but how many people actually go to the stadium? One of the things that we don't have enough people going to the stadium. So vaccine passport will work in those regions or countries where people do a lot of things. For example, going to the movie theater, eating out on every day and things like that. That's my own opinion. It may not work effectively in our own environment, because then we'll have to find out what do we restrict these people from. So this is the dilemma and this thing. And then when we talk about international travel is for the elite. It's not for the commoners, because you have to buy an expensive ticket to get on this thing. So obviously taking an yellow fever immunization card or getting an immunization is not a big problem to go to Dubai or somewhere. Majority of the people who need help do not have these options. They are rural people who need to be able to. So one of the ways, I'm not saying it's a compulsory, I'm just saying it's just my one opinion. Okay, people who are seeking for 350 grants. 12 million people have applied for 350 grants. We have a shortfall of about 5 billion people there who could be asked that, okay, if you want this grant, therefore you must present proof of immunization. Now, to me, those are some of the ways that we can do it in a morally acceptable way without taking away all the rights.
All right, thank you. Very interesting view, and we appreciate your time tonight, Professor Sylvester Chima from the University of KwaZulu-Natal.